Good evening, everybody, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here virtually tonight with Dr. Kirkpatrick. And tonight we're going to be talking all things dental implants. So welcome. Thank you for being here. So before we get started, we're just going to watch a short video about COVID-19 and the protocols we are taking to keep everybody safe.
Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Begin your New Teeth Now transformation.
Hey everybody. So we are excited to talk about implants tonight. How are you doing, Bianca?
Good, how are you?
Good. Are we ready to roll?
We're ready.
All right, here we go. So a little bit about me. My name is, as Bianca said, David Kirkpatrick. I'm one of the oral surgeons here at New Teeth Now at Florida Dental Implants. And, you know, just a little bit about my background. I did all of my school at the University of Kentucky, and that includes the UK College of Dentistry. And then my surgical training was done at the University of Florida. And one of the most important things you're going to hear tonight is that bold part of the screen where it says that I'm a board certified oral and maxillofacial surgeon. One of, whether you come here or you go somewhere else for treatment, make sure that whoever this treating surgeon is, make sure they are board certified, because that's kind of how we maintain their standard of care, make sure everybody's up to the same level of treatment. So dental implants, they are recommended by our National Association as the best way to replace missing teeth. And for those of you that do not know what a dental implant looks like, it's the silver structure that looks like a screw there. And a lot of people do get confused on exactly what the implant, even the term, means. A lot of people think that the implant is the tooth. In reality, the implant it's shaped like a screw, and it replaces the root of a tooth. In essence, it gives us a foundation to put your bridge on. So when we're replacing everything in one jaw, we put in anywhere from, around 6 implants, usually 4 to 6 implants, and we replace everything with one big bridge on those implants. So the implants go into the bone, the bridge gets screwed into the implants, and it looks something like this. So this is, a little artist rendition that shows the 6 implants in the upper jaw and the one bridge, that pretty much spans all the way across the upper jaw and replaces molar to molar, and it's fixated and kind of supported by these implants. So it doesn't come in or out. You can't take it out. It's only something that either us or a restorative dentist that's trained to deal with implants can take in and out. So, which is key for you as the patient, because it's as close as we can get to giving you something like your natural teeth back. There's nothing that's like your natural teeth, but this is as close as it can be when we're talking about replacing everything in one jaw. So tonight, I'm going to go over a lot about the implants, a lot about the hybrid procedure, and replacing everything in both the upper and lower jaws. And I'm going to show you a lot of before and after pictures of people that I personally have treated. I think that they do a lot better job kind of describing their journey of what they went through, and when they spent time with me with treatment, consult, and a lot of the post-op appointments. And it's cool for you as a possible patient that will be coming into our office to kind of hear what, from their perspective, of exactly what they went through. So Lori and Tom, they're 2 patients that I treated a few weeks apart, but I'm going to let them talk about their journey with us on this video.
I can't thank New Teeth Now enough for giving me this smile and the confidence, and it's just a wonderful thing.
We would have fallen in love anyway, but Having our new teeth makes it easier to be in love with each other. We met about 30 some odd years ago, 35, 36 years ago. Lori was working in a restaurant. I would stop there a lot of times for something to eat. And that's how we got to know each other. I remembered noticing her from when we first met, that she had a beautiful smile. We just started talking and hit it off as friends. I knew that she had a boyfriend at the time, and I was married at the time. Then we wouldn't see each other for another few months or talk to each other for another few months.
We pretty much had lost touch when I moved to Florida.
I had very poor teeth all my life. Primarily it was because when I was very young, I was sick and was given a lot of antibiotics, which affected the enamel in my teeth. So lifelong bad teeth.
I had bridges and caps and crowns and root canals and a whole life full of those things. And I had a nice smile. My teeth were nice, but then one broke. I felt inhibited now. I felt like I couldn't smile anymore. So I'd seen the commercial for New Teeth Now on TV, and I was like, wow, they can really do that. I'd love to have that done. Tom sent a poke to me on Facebook. So I then sent him a poke, and I said, I see your poke and raise you a wave. Tom had asked me to go to a barbecue with him, so we went to the barbecue together and we were having a good time.
Then at the barbecue, one of the things that came up was that Lori had mentioned to me that she was having this dental work done.
When I said to him, well, you're not doing anything, you're retired, you can fly, I'll fly you down and then you could take me.
Even then, seeing her after she had the teeth done, I knew that, wow, that's what I need to do. I knew I had a lot worse of a situation going on. At that point, literally, I was down to 7 teeth.
It affected the way he looked, the way he felt about himself, definitely the way he ate. It was a beautiful thing when he decided to get his done too. I was happier for him getting his done than I was for me.
At New Teeth Now, we can place a full set of beautiful, functional, implant-supported teeth in one day. And it's amazing to witness the look of relief and the joy on the faces of our patients. We love what we do, and we're grateful to be able to do it.
Everybody we've ever met, from Phyllis at the reception desk through all the girls and all the doctors, they just make you feel very comfortable, and it's a positive experience from beginning to end. It really is. Now we just look at each other and smile, and
yes,
we're amazed, and we fall in love every time we see each other smile. It affects every facet of your life. And we began to feel adventurous, like, you know, young and in love and just wanting to go out and share the world together.
They look beautiful. You look more confident. You're happier. You're talking more.
We can eat anything we want. You don't have to chop things up into tiny little bits anymore. And you're left with an absolutely gorgeous smile for many years to come. We just match in every way. And now we're a teeth match too.
All right, so that is a pretty cool story. And, you know, I love sharing that video on these presentations. Kind of talks about their journey and where they're at now and, you know, just what they went through with their smile transformation with us. And while we were watching the video, Bianca sent me a message that we did have a question come in, and it's a great time to answer that question, and also, you know, remind you guys that anytime you have a question, submit those, and we'll stop randomly throughout the presentation and make sure that we address everyone's questions as they come in. So, Bianca, do you want to go over the question?
So this person asked, can the procedure be done under twilight sedation or under general anesthesia?
So that's a good question. And, you know, with these procedures, we do them under general anesthesia. We choose to do it that way. I've done it both ways. I've actually done one of these under local anesthesia before. I said one of these under local anesthesia. There was also the last time I will do one under local. But, you know, under twilight sedation, yes, you're comfortable. but it's nowhere near as safe as it can be under a general anesthetic. So we have our anesthesia team here in our office. It's basically a surgical outpatient facility with, approved operating rooms. And we have a truly dedicated anesthesia team. Your airway's secure, so we don't have to worry about, gosh, are we using too much water or saline when we're irrigating? Or is the patient, can we suction that much out? Or can they tolerate that? Are they going to be coughing? Are they going to get choked? With this, the way we do it, it's as safe as it can ever be doing this. And the other thing is when you're totally asleep, I get to freely put the implants in the most ideal position that I can. Where if you're dealing with somebody that's under a twilight sedation or a local anesthetic and twilight sedation, you're still not completely out. So you can't tolerate, me stretching your cheek out maybe as much as I need to. And that may not sound really great to you guys, but it makes a big difference when I can freely put the implant in the most ideal position ever for you as the patient. And what that means at the end of the day is that implant's in a perfect position to attach exactly where I want it to connect to the bridge at. So yeah, we feel like that it is a lot safer, and at the end of the day, the procedure comes out not even close to how it would under twilight sedation. But that is a good question. And I'm going to talk a little bit more about that when we get into some of the other slides on how we do it and the things that we do during the consult and leading up to surgery. So we'll cover a little bit more about that topic in here in a couple minutes. Was that the only question right now, Bianca?
Yes.
Okay. All right. So why do people choose to have this New Teeth Now procedure? Well, number one should be to restore your total body health. I talk about this a lot when I'm doing, consults with patients that are coming in, and that should be the number one goal. A lot of our patients, most of our patients have, either a lot of decay, which is disease in the teeth, or they have a lot of periodontal disease, which is, basically gum disease that results in a lot of bone loss. And, when we do this procedure and we take out the source, which is the teeth and the periodontal ligament, then that infection is gone from that day moving forward. So that should be number one. Number two, it's kind of easy to read that where it improves the self-confidence. But that's a real thing. And that leads into the next one, which is it helps patients bring out a smile. We see a lot of patients that are truly they're self-conscious about the way their teeth look when they're smiling, when they're out to eat with friends. Sometimes they're even reluctant to go out to dinner with their friends or family. And, they'll constantly tell us that they're covering their mouth with their hand when they're talking or when they're eating or chewing because they're just embarrassed of the way their teeth look. And that leads to the next one, which is your ability to eat. A lot of our patients have a lot of pain during, in their current situation when they're during chewing or when they're eating anything really hot, sweets, cold. A lot of that is affected by how much decay or bone loss you have around your teeth, and they can be extremely sensitive. The next one, you're asleep during the entire procedure. It's kind of like the question that came in, but most of our patients view that as a huge benefit because you are asleep during their entire procedure. I saw a lady for a consult today who she told me she had extreme anxiety and almost had a panic attack every time that she went to her dental visits. She said she would just be there for a routine exam and a cleaning procedure. And when the doctor would come into the room to check her, she got so anxiety ridden with him walking in that she said sometimes she's even gotten up and left and never even had the exam. And so this procedure really does help patients like that. Because if you're scared, you come in, you get one IV put in your arm, the medicine goes through that, you drift off to sleep, we secure your airway, and we do everything while you're asleep. You wake up and it's over. So it can't get much easier than that for a lot of our patients that are truly scared and have a phobia of going, to the dentist or, having some type of procedure completed. And then the postoperative pain level, when it's all said and done, should definitely surprise you. It continuously surprises us every time we do this procedure. We do give you pain medicine. We give you a prescription strength ibuprofen. We give you a narcotic if you need it. But, the bottom line is most of our patients come back and they say like, hey, Dr. Kirkpatrick, you gave me a narcotic and, you gave me like 12 pills. I took one the night of the procedure because I was scared I was going to hurt. But I never needed anything else. And to be honest with you, I don't even know if I needed that pill. I took it because I was trying to prevent the pain from happening. Most of our patients do just fine with Tylenol and ibuprofen. And that's a good thing. And there's a lot of good reasons for that. And we can talk about that when you come in for a consult. But we do everything we can to make sure that there's no little sharp bony edges. We don't want you to have the bony splinters that a lot of people get after they've had their teeth taken out and dentures placed. We just don't run into that because there's a lot of things that we do with the New Teeth Now procedure where everything is closed, there's nothing exposed, and your teeth are solely supported on the implants. So they're not resting on the gums, they're not putting pressure on your gums or your jaws, and they're totally secured with the implants. And that makes a huge difference, during the immediate recovery. So the oral body connection, one of my favorite sayings that I use, and I kind of came up with this when I first started doing these procedures, but the mouth is the gateway to an awesome creation. And if you really think about that, it's one of the first things that a lot of people notice. A lot of people will say like, oh, I look into somebody's eyes or look at their face in general. But most people really look at teeth. And there's a big difference when you're talking to somebody and they smile and they've got like one tooth in the front versus somebody that has a really nice smile with a full set of teeth. And a lot of people notice that. So it is a pretty awesome creation. It's one of the first things that people notice, but it's also the first thing that encounters the air you breathe, the food you eat, both of which keep you alive. So it's super important when you're breathing in. If you have a mouthful of bad teeth, mouthful of periodontal disease, you're going to breathe in and the air passes by all that bacteria. And no doubt some of that bacteria gets sucked down into the lungs. We know that from COVID that's going around. You breathe in and that's where COVID goes. It gets lodged in the airways. So that is a real thing. You want to try to eliminate as much of the bacteria that the air is passing by to get into your lungs. Also digestive diseases. You're chewing your food. If you're chewing your food in a mouthful of bacteria, where do you think that goes? You swallow it down into your stomach, and that can start to affect a lot of other systems. It definitely increases your chance of having a heart attack and the rest of the cardiovascular system, increases your chance of your risk of osteoporosis, your risk of stroke. Definitely there's a big association between periodontal disease and diabetes. But what it all comes down to in the end is the longer your body's fighting a low-grade chronic infection, whether it's an infection on your big toe or it's a mouthful of bacteria, the more your body's trying to fight a low-grade chronic infection for years and years and years, your immune system is just working overdrive. And the longer your immune system is just constantly working on something that's constantly there and can never get better until it's removed, it reduces the effectiveness of your immune system, which can ultimately shorten your life expectancy. That's serious. So I go over and over with patients. The number one reason you should be doing this is to get back to an overall healthy state. And your mouth is a big part of your body. Periodontal disease, this is what it looks like. If you look at the before picture on the left, let me see if I can get my pointer working. So this is periodontal disease. That is, the bone has shrank away, the gum follows. So this dark stuff that you see where my laser pointer is, that's decay and periodontal disease, where the bone has shrank away. Same thing here. Look at the big gaps in between these teeth. And those teeth are also mobile. They move, they can wiggle around because they lose the support of the bone. And what we do is we take those out, clean everything, get rid of the infection, put the implants in, and this is the same day. Same day. This is before, immediately after, before we put the teeth on. This is showing the implants in with the little impression pins that I used to take an impression with the temporary teeth over the implants so we get that exact position of where the implants are. And you can see even some of the sutures, that's the stitches there, that has everything nice and closed. But this picture, the patient came in with periodontal disease, leaves with a clean slate, starting that afternoon when they walk out of our office with no periodontal disease. And this is what it looks like before, and this is about 2 weeks after. You can see nice, pink, healthy gum tissue. These are called abutments. They're the little connectors that attach to the implants, and those are what the teeth get attached to. And here's what we can accomplish with those. So before, after, beautiful smile, looks totally natural. I love this guy's smile. I think he did a really good job at picking out, and patients get a chance to really have an influence on what your teeth look like. You play a big role in picking out exactly what you want your teeth to look like. And he wanted a more natural appearance, but also just a nice, pretty smile. He didn't go with perfectly straight, really bright, white Hollywood teeth, but it looks very natural on him. And, the general public walking down the sidewalk, eating dinner with this man in a restaurant would be very hard pressed to look at him and have any clue that he had any procedure done, and those were not his natural teeth. So if you want to be truly healthy, you must restore your oral health. So who is a candidate to have this procedure done? Well, if you don't have any teeth or you're unhappy with your dentures, you are 100% a candidate for this. If you have a mouthful of bad teeth, definitely you're a candidate. And I'm not, promoting just everybody with some cavities on their teeth come in and have all their teeth taken out and implants put in. Like I said earlier, we don't, there's nothing that's as good as your natural teeth if you can predictably save your natural teeth. But a lot of patients get into that where they've had a filling, they've had another filling because they got decay under the filling, they've had a crown put on, they have a root canal done through the crown with another crown, and then the tooth fails. Once you get into that wheel and you've done pretty much everything you can do to try to save your teeth and you're still having problems, then that's when, in my opinion, it's time to call it, take them out, put implants in, and move on with life where you're not constantly thinking about, well, what's next? What's going to fail next? What else am I going to have done on my teeth? How much time is it going to take to get my teeth back to where they don't hurt anymore or they look halfway decent? So, there is a time where someone has to make the call, and we can help guide you through that. And I have patients come in that, I'll say after doing the consult, you really need to save your natural teeth. You're not a candidate for this. But if you have a mouthful of bad teeth, you're definitely a candidate. If you have severe periodontal disease, you're a candidate. And with a severe periodontal disease, you really need to think about having something done or at least getting the teeth out because the longer they're there, the more bone loss is occurring, and you may not be a candidate for implants in the future if all the bone shrinks away. And then the last thing, if you've ever been told that you don't have enough bone for implants, I would definitely urge you to come in and talk to me and sit down and go over your CT scan and have a consult. This is a huge thing that we see patients all the time that have told us that, well, you're my third opinion or you're my fourth opinion, and everyone's told me that I don't have enough bone for implants, and I saw your commercial, and I'm here kind of just on a last ditch effort to find out, is there anything you can do to help me? And I can tell you that I started doing this in 2007 here in Lakeland, and I've yet to have a patient that I could not do this procedure on because they didn't have enough bone for implants. I can almost always find enough bone somewhere for implants. And we have a lot of different techniques that a lot of other people don't have that help us do that. So another patient that I treated, and this was, a few years ago. I love this patient. He came in, even with his before picture, he had a super outgoing personality. He would talk to everybody. He would smile, laugh, telling jokes, very excited about trying to find out that if we could do anything for him. He'd been told that he really wanted a candidate for implants and that he needed to have a denture made. He really didn't want anything removable. He came into town and we got everything set up. And here's his before and after. And if you look at that, that is, that's kind of self-explanatory to what we can accomplish with these implants. If you look at his before picture, very gummy smile. And if you really look at that little black dot above the laser pointer, that is infection from one of these front teeth that has eaten its way through the bone, through the gum, and draining into his mouth. That's a severe infection that, you do not want that to just kind of linger. So we took everything out, cleaned out the infection, put in implants, and this is his after picture. And I'll tell you that that's probably about 1 month from surgery. So that is a huge difference between before and about a month after surgery. And we love seeing, patients go through this transformation. And somebody like this, he was very outgoing before the procedure. Now when he'd come into the office, he was telling everybody in the waiting room, which is kind of a cool setup too. It's actually a theater. So our waiting room is a movie theater, and he was talking to everybody in there, telling about his journey and what he went through and wanting to show everybody his teeth. We can also take someone who, has dentures. If you look at her before picture, it doesn't look terrible. It's a denture. But at night, she takes these out, sets them by her nightstand or on her nightstand beside of her bed, and, goes to sleep, and she doesn't have any teeth in her mouth. She was tired of having something that was removable. So she wanted to know if she was a candidate for implants. She'd been told in the past that she wasn't. And if you look at the picture that I'm circling with the laser, obviously you can see they do look a little different. They look better, a little more natural, and they're fixed. They're screwed in bridges. No longer is the roof of her mouth covered. No longer does she have the wings that go up and underneath the cheeks and the lips. These things she brushes them, toothbrush, toothpaste, just like you would your natural teeth. Has them professionally cleaned every 6 months, just like I do with my natural teeth. But that is, it's really cool when you can take somebody who's used to really watching what they eat, or they can't take a bite of an apple, or they can't eat corn on the cob, or they, have to cut their steak up into small bites and chew equally on both sides at the same time. Now she can just cut up her steak and eat it just like anyone else does with natural teeth. So it's, it's a cool thing when you can help somebody and really change their just daily routine activities from somebody who has to think about every meal of what they're going to eat because they've got a denture in, and what they're going to do at night to take it out and wash it under a sink, to brushing your teeth before you go to bed. And then this patient, another patient that had dentures, she had a full denture on her upper jaw, hardly any bone. She had been told by multiple surgeons, multiple dental specialists, that she was not a candidate for implants because she didn't have enough bone. And then she, on her upper jaw and then the lower jaw, she had 2 implants placed, that she had an overdenture that would snap onto these. And, it does help retain the denture, gives her a little bit more support. But if you look, the implant started to fail a little bit. You can see some of the threads showing of the implant. And she wanted something that was fixed and never came out of her mouth if we could do that for her. So she came in, we had a consult, we went through her scan, and when you see her after picture, obviously you know that we were able to treat her, and we were doing that with zygomatic implants. So people who do not have hardly any bone in the upper jaw, we can totally bypass where you don't have a lot of bone and anchor these things into the zygoma bone, which is your cheekbone. We go into the lower part of the cheekbone, And what that does is enables us to put the implants in the same day without bone grafting, because in the past, or if you saw someone who was not trained to do zygomatic implants, then your option is to do sinus lifts, bone grafts, let those heal for about 7 or 8 months. Then you come back and put traditional implants in if enough bone took. With the zygomatic implants, we don't have to do the sinus lift. We don't have to do the bone grafting. We don't have to wait on the bone graft to consolidate or harden. And we can put the implants in the same day. And I tell patients this all the time when I'm in a consult. Anytime, in my opinion, and in my hands, anytime that I can put implants into bone that you have grown and developed with versus bone that I'm trying to put somewhere and make you grow, it's always stronger if I can put it in the bone that you give me, but with what you've developed. So that's what I choose to do and how I treat patients. Before zygomatic implants, out-of-state patient, and by the way, we see a lot of patients from out-of-state that, you know they need zygomatic implants, or they know they probably don't have a lot of bone for implants. And thankfully, they find us through the internet, from YouTube videos, and they get to our website, call, schedule a consult, they come down, and we try to do a lot of stuff to prepare for that consult before the patient even gets here from out of state. We've actually treated, and some of my favorite people in our office, they told me they got tired of me saying this, so we've kind of went out on a campaign. There's one state that we do not have a patient from. So if anybody's on here that is from North Dakota, hey, you need to call me. We may even work something out. North Dakota is the only state that I have not treated a patient from with this New Teeth Now procedure. But anyway, this young lady came in from out of state. She needed zygomatic implants, searched us out. She's got great bone in the front and the middle part of her upper jaw. She was lacking bone in the very back. This is one big bridge that's secured and cemented on, a few of her natural teeth that she still had. The problem with it is this whole bridge moved. It could come in and out, and it was failing. She was losing it. She didn't have enough bone for implants, and they had talked to her about doing a denture. So she found us, came down for a consult, and with the zygomatic implants, which this is what they look like. They're a little longer. They anchor into the back part of the lower part of the cheekbone. But what they do enables us to give patients this. Give you your smile back in one day without bone grafting and without waiting on a bone graft to heal. They are the greatest things ever if you need them, the zygomatic implants. For patients that don't have a lot of bone in the back part of the upper jaw, as you can see with her, these are traditional implants, enormous amount of bone, but you see right behind that implant, this is the sinus cavity, and the bone goes from this tall to this tall. So she has hardly anything there, but she has enough that we could do zygomatic implants. And I'm going to show you a little animated video, that kind of a 3D picture of what the zygomatic implants look like. So that's coming up right now. So as this video is turning, these are the zygomatic implants, the longer areas that obviously are a little bit different from the 4 implants in the front, but that's how we can screw these bridges on. And there it shows the little micro screws, titanium micro screws that are connecting the bridge to the implants. And that's how we can accomplish this in just one day. So it's a really, really cool thing for people who need them. So this patient, like the one you saw before, has decent bone in the front part and the middle part of the upper jaw, just needed a lot of help with the very back. But we see a lot of patients like the patient that I treated today with, for my procedure. So we do one of these pretty much every day. Both me and my partner, Dr. Richards, we do one of these full mouth implant cases every day. And the lady that I had the opportunity to be a part of her transformation today, she had hardly any bone in the upper jaw, nowhere. So what we did with her was called a QuadZygomatic implant case, where we did 4 zygomatic implants and then 1 in the front, because I was able to find a little bit of bone in the very front part of the upper jaw. So I try to put in as many implants as I can. It usually works out to be 6 implants always, unless it's a QuadZygomatic case. If it's a QuadZygomatic implant case, then it's typically 4 implants, sometimes 5, sometimes 6, because those zygomas are so solid, supportive, and stable, they can truly support that entire bridge. So the New Teeth Now total facial makeover. That's another part of my practice where, I do full face cosmetic surgery as well. And a lot of times we'll have patients that'll ask, hey, I'm coming in, my primary concern is my teeth. I want the implant bridges, but I'm also, is there anything you can do for some of the wrinkles around my eyes or my excess skin on the upper eyelids or, kind of the turkey neck, the turkey gobbler deformity on the neck. So some of my practice is that we can do chin and cheek implants, and those are different than the zygoma implants. These are actually the silicone cheek implants that are made more to give you that enhancement and more support underneath the cheekbones, purely for a cosmetic reason. Eyelid surgery, rhinoplasties, nasal, reconstruction, brow lifts, facelifts, neck lifts with liposuction, and then the lip lift. A lot of our patients that have this done have a real thinning or not very much of an upper lip. And, the older we get, you lose some of the elasticity in your skin. So everything kind of falls down and forward. Everything. We all know that. And so, part of the head and neck is your eyelids, your eyebrows fall down, your cheeks fall down. You get the nasolabial folds where you get these creases here that a lot of people are doing fillers for. I would rather treat that with facelift, the marionette lines, and, obviously the neck. But your upper lip also can fall. And when it does, it becomes elongated. So we can do a upper lip lift where it kind of rolls out some of the red part of the lip, gives you more surface area to put your lipstick on, and we can do that without doing fillers. So it's a really cool thing that we can do at the same time that we do this implant procedure. One of the patients that had something done at the same time of her implant procedure is this young lady. She came in to talk to me about her teeth. They were failing. She wanted the implants. So we did that, but at the same time, I also did full face CO2 laser reading. And if you look at the before and after, this after looks like the before lady's younger sister. She didn't like the sunspots, and obviously we live in the Sunshine State. And so we see a lot of patients who have, been in the state for a lot of years or grown up here and, beach baby, they've got a lot of fine lines, a lot of wrinkles, a lot of sunspots. The CO2 is a wonderful tool to use to help erase some of those wrinkles and definitely gets rid of a lot of those sunspots. And we could do that at the same time with our teeth. Facelift, if you look at the jawline and the neck here, now the after picture, definitely a more enhanced and defined lower jawline. Her neck is improved, and she also had eyelids and a brow lift. So a pretty significant difference. Same thing with this lady, brow lift, face lift, neck lift with liposuction. And, if you look at her, one of the things that I really pride myself in, one part of my philosophy of doing cosmetics is I don't ever want to put someone in a position where we give them that wind tunnel look or the true plastic surgery, screaming, I've had plastic surgery. I want you to look better, but I want you to look natural. And I want to be people that hadn't seen you in a while, man, hey, Shirley you look good, Shirley. What have you had done? And, you have that more refreshed. I want to try to take away 15 to 20 years. And sometimes we can do that with this New Teeth Now procedure. Chin implant, great tool to do at the same time. If you look, very retruded lower jaw chin, this is immediately after a silicone chin implant. It takes 30 minutes to do that and makes a huge difference with a before and after. So a couple things about implants that sometimes we get asked. Most people can kind of figure this out and they already know this, but I do get asked occasionally like, well, if I do these, what's going to happen in the future? Am I still going to need a root canal? No. Implants, they're 100% fake. There's no nerve canal. You can't ever get into a situation where you need like a root canal done. They're never going to decay. You're not going to get a cavity on these things. And, and they're very, very easy to maintain. So what we recommend doing, and I go over this in detail with you when you come in for your consult, but, when you have this procedure done, okay, you've spent some time, you made the investment, you come in, you have the procedure done. Now, what do you do to take care of this? We get asked this all the time. You brush them, toothbrush, toothpaste, twice a day. When you get up in the morning, before you go to bed at night. The other thing that I like for patients to use, and I highly recommend it, we actually give you a Sonicare toothbrush, which I think is the best thing that you can use to clean these teeth. It's the best thing you can use to clean your natural teeth, but also a water pick. So you can't floss in between these because they are totally one piece and connected. There's not that space in between the teeth. So underneath, I like for patients to use a water pick to kind of irrigate and clean food debris out from between the gums and the bridge. That's it. That's what you do. And then every 6 months, you go to your general dentist or you come here, just like I do with my natural teeth. You get them professionally cleaned. Anything that you can't take out of your mouth and wash under a sink with soap and water, you have to get professionally cleaned every 6 months because it will develop plaque and calculus, just like my natural teeth do. And those have to be professionally cleaned. But it doesn't get any easier than it can with these for those cleanings. So if you're kind of scared or apprehensive about going in and having a dentist or a dental hygienist scrape on your teeth, you don't have to do that in these. You go in, they unscrew them, take them out, take them to the back, put them in a ultrasonic disinfectant, cleans them, they get them out, steam clean them, which gets rid of any stains, basically takes them back to new. And, with no stains, they look new again. They check your gums, look at the connectors, put the teeth back in, you're done. So you do that every 6 months. Super, super easy, especially for the people that are kind of the dental chickens. So if that's what has kept you or kind of kept you from going to the dentist to get your teeth cleaned, it can't get much easier than it does with these. Our New Teeth Now procedure, it is all under one roof. We hear from patients all the time how nice that is to have that here. And, until you actually go through the process, or if you've been somewhere else for a consult and, they tell you that, okay, you're going to have your consult here with me, then you're going to go to the restorative dentist and you're going to go to the lab and your surgery is going to be done in an outpatient surgery center somewhere else. Then you're going to go back to the restorative dentist to make your teeth, the next day. Everything is done here under one roof, from your consult to your impressions, your surgery, we have the in-house lab. I mean, your teeth are made here. We don't send them out. They're not made in a lab in California or outside of the country. They're physically made in our office, including your final teeth. And that is hands down super important because we control the quality. And it's really important and a huge benefit when whoever is making your teeth can come out and look at you with me or the restorative dentist and look at your face, look at your teeth, talk to you about any, what your expectations are and what you want them to look like, because they're making them. Like they have the hands that are actually making them, or putting it digitally into the computer and having our milling machine make your zirconia teeth. And that is super, super, super important. I mean, matter of fact, today, on the lady I was telling you about earlier that I did the QuadZygomatic case on, we I did the procedure, sent the teeth to the lab. They fit them perfectly to her implants. I put her teeth in, and there was something I had a question on. Had Jack, our lab manager, to come down and look at I was like, hey, can you just come look at her with me? I want you to see this. So when it comes time for some of her follow-up appointments, if we want to make any changes, if she wants to make any changes, then you have an idea. He came down, took some pictures on, so we could load them up into our chart and our system. And now he knows everything he needs to know, that if we have any questions or we want to change something, super easy to do. So everything all in one day. The procedure is done just in one day. So when patients come in with either no teeth, mouthful of bad teeth, bad periodontal disease, whatever shape they're in, we take the teeth out. If there are any teeth there, we put the implants in, clean the infection out, and put the temporary teeth on the same day. That is one thing that I want to hit on this slide. So the teeth that we put on the same day as the surgery, they're temporary teeth. They're made out of acrylic. And we do that for a couple good reasons. One, they're very easy to adjust. And B, you play a big role in picking out what you want your teeth to look like, but we don't really know exactly what you want. And you probably don't even know either. So we try to get you perfect with the temporary teeth. And you wear those for 6 months while your implants are healing. And then we start making your final teeth, which are zirconia. And the zirconia, there's not a material in the world that's as good or better than zirconia. From a strength standpoint, from how the cosmetics of them, to how they feel and what you're able to eat with them. So a huge luxury is you wear that temporary set of teeth, and we call them your test drive set. So you wear those, and if there's anything you want to change, or you're like, you know what, I was kind of scared to get really white teeth or perfect teeth on this, but I think I want to go whiter on my finals. Super easy. We can change that. That's a very easy thing to change. You can change pretty much anything about the appearance of them, going from your test drive temporary set to your final zirconia set. So your first visit with me will be for a consult, and that's about an hour appointment where you come in, you meet with me and one of my implant coordinators. And what we do at that appointment is we get a CAT scan, which we call an iCat. And you can see this lady in the picture. She's having the CT, the CAT scan done. And then we use that to develop a treatment plan, talk to you about your expectations, and really go over the scan with you. So by the time you leave my consult and you've spent some time with one of my coordinators and me, you've seen your CT, you've watched me go through the scan and basically treatment plan your entire case. So sitting just kind of casually talking with my patients during a consult, I've treatment planned the whole case, and it is so specific that I even know almost down to the millimeter exactly what size implants that I'm going to be using. So it's very, very detailed appointment, very detailed CT scan, because I want you to see exactly what I'm going to do. And I want you to know exactly what kind of bone you have, where your best bone is, and where I'm going to put the implants. So when you come in for that first visit, you'll meet with me and one of my implant coordinators. These are our coordinators, Shauna, Debbie, and Mara. All three are very experienced, very knowledgeable with what we do. They've been surgical assistants in the past, so they've actually seen the procedure being done, and so they are very, very informative. But usually by the time I walk in the room, and they've spent a few minutes with you, most patients look at me like, yeah, hey, Debbie's already gone over that. Oh yeah, Shauna told me that. Yeah, Mara showed me that on the scan, and I'm like, what do you really need me for? But we do go over everything in detail, but that's very important for patients to know and find out as much information as you can. And then if you still are not sure about, what you should do, I encourage second opinions, third opinions. I want you to know as much as you can, because I try to treat everyone like you're my family member sitting in that chair across from me. And the more you know as a patient, the happier you're going to be when it's all said and done. My restorative team, Dr. Nafala, Dr. Dibbs, and Dr. Sorrento, all super nice guys, very experienced. They love what they do. It shows. You'll see that when you meet them. And, you know, they're just invaluable team members that help us help patients ultimately get to their goal at the end of the day.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many years, bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
His perspective on being a part of an office that has everything under one roof and the importance of that. So here is my surgical staff. These ladies have been with me for years, and they're a huge part of the team where, with them having as much experience as they have and have been with me personally for years and years and years, they know exactly what's going on. They know pretty much exactly what I'm going to be doing. And for the most part, before I even ask for an instrument or we talk about what's going to happen next, they already know. And, they're telling me, or they've got it in their hand ready to give to me, or they're asking me something that, that I'm about to ask them for. They're telling me, hey, are you going to need this, or you going to need, this instrument or that instrument or this implant? So invaluable to have them as part of the team. And like I said earlier, we're all a team, and without each and every one of us, I can do the best job I can do as a surgeon, but if I don't have them helping me, my job is a whole lot harder, and I may not get as good a result as I can get with having them part of the team. Our anesthesia team is Jack and Kim. So they've been with us for years, and you can read this slide's. We put this slide together. It's a couple years old, but Jack's been doing this for well over 30 years. Kim has probably got around 30 years of experience doing this now. They both have worked in a hospital setting. They both worked with cardiovascular cases. And, that's very important when we're looking to treat patients as safe as we can. We want the best helping us put our patients to sleep and getting them through that part of the procedure. And we feel that Jack and Kim can do that. They've actually put one of my daughters to sleep for me while I had to do a small procedure on her, and I can tell you that if I trust them with my kids, I definitely trust them with my patients. And here is our team. I love this picture. It's a new picture that has everyone in it, but you can tell there's a lot of people that work in our facility that help make this possible. To take a patient from no teeth or a mouthful of bad teeth to their goal in the end, and it takes each and every one of the people that you see in this picture. So one last before picture that I want to show you and talk to you about, but before we talk about Mary, Bianca did tell me that there were a couple questions that came in, so I want to take some time and address those and make sure that we do get all of your questions addressed.
The first one is, do you take a second impression before you make the final teeth?
Yes, we do. So, and that's really important because we know a lot of things change, and that includes your gum material or the gingival tissue. And when we put in these implants, just for example, if we take somebody who has a mouthful of periodontal disease, the gums are not happy. They're usually a little inflamed. They're usually swollen. And when you take those teeth out, clean everything, put the implants in, put your new teeth on, your gums are going to change, and sometimes significantly. They'll shrink down to a real healthy, happy, level and state. We know that's going to happen. We account for that when, we put the temporary teeth in. We know your gums are going to shrink and you're going to get a little space there. You're not going to like that space, but it's only there during the temporary phase. So when we start making your final teeth 6 months later, once the implants have totally healed and your gums have leveled out, we take a new impression, start with basically from scratch again, building your teeth to any changes that you want, but definitely to the changes that your gums have gone through during that initial healing. So yes, we do take a new impression.
Great. And then, so the gums recede during the healing process, but do they recede just as a person ages in general?
Not as long as they're healthy. Gums only recede when, if you think about it, the gum's going to shrink away from things that it doesn't like. So if it's inflammation from a big cavity in a tooth, the gum's going to try to shrink away. The gum's going to shrink away from people who brush with a really, really hard toothbrush. The gum's going to shrink away with people who have bad periodontal disease. But once we take away that disease and teach you how to clean these things, then it's not just going to recede because you're getting older. It's receding because it's pulling away from something that it's not happy about. So I've got a little video about Mary kind of going through her story, and then we'll kind of wrap things up.
People, sometimes they think that I'm upset at them or that I'm unfriendly just because I don't show my teeth. So I don't have a big smile because of that. A lot of the other dentists told me that I need a bone graft, and because of that, I was going to take some time to do it. But when I met with Dr. Kirkpatrick, he just said that he can do it. I'm scared to death, okay? All those things just go through your mind. But I know that Dr. Kirkpatrick will do me right. It's been 2.5 months since I had my surgery, and I feel great. I didn't have any pain. I have beautiful teeth. Not only I'm saying that, but people surrounding me saying that. It is wonderful. I like the person that I'm looking at in the mirror. I made a decision this year that I was going to change my life, that I was going to do things for the better. And then one day I was in the lunchroom and I saw a commercial from New Teeth Now, and I decided to make a call. Dr. Kirkpatrick and New Teeth Now told me it would be just one day and I will feel no pain. I didn't believe him at first. You crazy? You want to pull all that? And it's not going to hurt. Nothing is going to happen. So I told him that I had one more dentist to ask. My dentist, his answer was, you're better off going with him. So I called Dr. Kirkpatrick, I made the appointment, and on June 22nd, I have it done. The day of the surgery, I got there about 7:30, and I was very anxious and nervous, and the girls there made me at ease. Dr. Kirkpatrick walked in and he said, are you nervous? And I said to him, yes. And he said, me too. So we laughed about that. I remember the anesthesiologist putting the medication in my IV, and the next thing I remember, I was waking up. I woke up with no pain. I was drowsy, of course, but little by little the anesthesia went off. Within 4 hours after I woke up, Dr. Kirkpatrick came with my new teeth and he put them on. And I have new teeth since then. It was a wonderful experience. I can eat anything with the new teeth. I'll be able to chew nuts and steak and all kinds of hard stuff that I wasn't able to chew before, that I was just swallowing without digesting. I feel healthier. I don't have as many stomach pains as I used to have, and I feel better. In one day, they were able to do everything that other doctors couldn't do, wouldn't do, or it will take them 2 years to do.
I am personally dedicated to helping people overcome the challenges of periodontal disease, dentures, and missing teeth. At Florida Dental Implants, our team of over 50 specialists are committed to help you get your smile back all in one day.
Before New Teeth Now, when my friends pull out their camera to take a picture that we were going out or anything, I would hide my smile and hide my teeth. I was ashamed of that. But now with the new teeth, I just show them my pearly whites all the time.
So here's Mary's before and after picture. I love that video. And that is definitely true. When I walked in the morning of her surgery and I was like, hey, Mary, like, are you ready to do this? And she's like, I'm a little nervous. I'm like, well, I'm a little nervous too. But we kind of laughed about that. And I meant that too, because I told her that I'm not truly nervous or worried about it, but I'm always on edge about doing these because I want to be sure that I'm on top of my game for every patient so I can get the best result that I can for every patient. And, you know, she and I had a good laugh about that because I think it concerned her a little bit when I told her that, well, I'm nervous about doing this too. And then I reassured her that I'd placed thousands of implants at that time and she was in good hands. So just to kind of reiterate about what happens here at our office and how we do things here at this office, this is kind of the process of what you would go through. The consult, the pre-op and impressions. This is when we get molds of your upper and lower jaws, talk to you about what you want your teeth to look like for the temporary set. And then we do our New Teeth Now procedure. Then I see you for any post-op appointments and adjustments. Then we fabricate and make your final teeth out of zirconia. And then the rest is history. You go on, you don't have to think about the dental life anymore. You come in for routine care, routine maintenance every 6 months, get your teeth cleaned, and we help you keep them nice and healthy.
I just wanted to talk about some resources that you can look into. You know, you've watched this webinar with us, and if you are interested in learning more, we do have our YouTube channel. So that resource is awesome. And so YouTube is at New Teeth Now. You can search that and come up to our channel. We have testimonial videos, general information, question and answer, and more webinars. And then for our social media, we post a lot of before and afters, and just lots of good content. So you can follow us on Facebook, Instagram, and Snapchat. But we really thank everybody for joining us tonight. We appreciate you taking the time to be here with us, ask us questions, and learn a bit about the New Teeth Now procedure. And I do encourage you to give us a call, schedule a consultation. We are here to answer all your questions and make you feel comfortable so you can make the right decision for you. All right, everyone. I hope everyone has a wonderful night.